All yours.
Okay, my name is Karen, and boy, my story goes on for quite a while because for years I've had problems with sinus issues, earaches, tooth issues, pain in my teeth, sensitivity. So I've kind of been dealing with each of those symptoms individually, and I'm starting to suspect now that all of this has been tied to one situation, which has been TMJ. So I guess I have to go back about 8 or 9 months ago. I had seen an ear, nose, and throat specialist for sinus issues and headaches and things, and I had a particularly bad earache, as I said, about 8 months ago, I guess, and I called my family doctor, and he put me on an antibiotic, which I've been on many times for earaches, and after 2 weeks of that, the earache had not gone away. It was the same as ever, and he put me on another round of antibiotics. And after a month, I went in to see him, and he looked carefully at my ears and said, I don't think there's an ear infection there. I don't know why your ears are hurting you. But he said, I think you may have some jaw issues, because he noticed my jaws were clicking, and my jaws have been clicking and popping for years. So I went to the dentist, and he said, yeah, it looks like you might have TMJ, so you need to go to Happy Harry's or some kind of a pharmacy and buy a night guard and start using that. He said, I can fit you with a night guard, and so he said, we'll see how this works out. The earaches continued. I got a book on TMJ, and I realized part of that could be stress-related, so I started seeing a counselor. The counselor told me to see a chiropractor, so I went to a chiropractor, still having earaches, and this was, at this point, had been maybe 3 months of earaches. I was on ibuprofen or some kind of medication all the time, around the clock, and I was really getting concerned about my own health with so much pain medication. The chiropractor helped temporarily. I mean, when I would go, I would feel better for a while, but still nagging earaches. And I was getting nervous. I was feeling like I'm treating my own medical condition here, because everybody really wanted to help me and had good ideas, but nothing was pulling it all together. So by late August, this had been going on for maybe 4 or 5 months at this point, someone told me that I really need to see Dr. Yu. She said she had a friend who had some jaw issues and that she was really being helped. So I talked to Lou and Grace and started coming to see them in August. This is now December. The first thing they did was something that my dentist had never done, which was to give me a thorough set of x-rays on my jaw. My dentist had never even felt my jaw or really examined it thoroughly, and so I was glad for that. And they did a really great examination and said definitely TMJ, definitely a bad case of TMJ, and that was most likely the source of the earaches and a lot of issues I've been having. And so they fitted me for an orthotic, and it's great. It's comfortable, and I'm supposed to wear it around the clock. I don't wear it as much as I should, but I definitely wear it in the evenings and at night all the time. And I really noticed some changes. First change I noticed was the earaches disappearing, and that's just been a blessing. By the end of September, early October, I realized, it wasn't even deliberate, I just realized, gosh, I haven't taken ibuprofen in a while, and it just made me so happy. And I knew it had to be directly related to this treatment. I also noticed waking up in the morning and not having the tooth and sensitivity issues that I've been having. I am going to continue seeing a chiropractor because I think that's helpful, but this is definitely my main treatment, and it's so reassuring to know that Grace and Lou know everything that I needed to be doing. They're referring me to the chiropractor. I'm coming in for a series of appointments, and part of what they do is called tensing, and basically they hook up these little electrodes to my face, and it sounds really strange, but it's relaxing. My face gets pulses of energy to the areas that are affected, but it's not painful at all. In fact, I just finished a tensing treatment, and I worked on my Christmas list at the same time, so I can honestly say that nothing that they've done here has been painful. A little weird, a little uncomfortable now and then, but nothing painful, and definitely worth it. I've actually, as I said, not using ibuprofen anymore, but also I've reduced my sinus medications, and I'm beginning to think things that I thought were sinus infections or sinus related may have also been related to the TMJ. Also, my sensitivity toothpaste I've been using religiously for a while. I've been slowly but surely weaning off of that. I've noticed my teeth just seem healthier. So I think my story is going to have a happy ending. It's not over yet, and they're really good about setting up regular appointments for me, but I am very happy about what's been happening, and I hope in a year that if I'm ever on this camera again, I can say that I'm better. So thanks to Grace and Lou and to a great program.
All right.